This section of our DVD is devoted to an amazing breathing technique called diaphragm pacing. We're going to explain what diaphragm pacing is and how it works, go over some troubleshooting tips, and share some incredible success stories. Let's begin at the beginning. What is diaphragm pacing?
Diaphragm pacing is a technique where we actually use the child's own diaphragm as the ventilator, if you will. So this requires surgical implantation of an electrode around the phrenic nerve, which is the nerve that runs from the neck down to the diaphragm. That's connected to a receiver, which is usually implanted in, under the skin in the abdomen here. We usually implant it there at least. And then there are some external devices that can be used to provide some electrical energy to that so that we actually stimulate that phrenic nerve to have the diaphragm contract.
In children, diaphragm pacing is most commonly used for two medical conditions.
The two are, one is high spinal cord injury. That is, if you have a child who had a spinal cord injury in the C1, C2 area, the phrenic nerve, that is that nerve that goes from the spinal cord down to the diaphragm, is actually still viable. Now it's disconnected, if you will, from the brain, but it's still viable. And so one could put phrenic nerve electrodes on those nerves and ventilate these children that way. Here at Children's Hospital Los Angeles, the more frequent group that we have used diaphragm pacing on is a group of children who have a rare disorder of respiratory control called Congenital Central Hypoventilation Syndrome, or CCHS for short. This is a group of children in whom their brain does not tell them to breathe frequently or deep enough, and specifically these children don't breathe during sleep. This disorder, as I said, it's rare, but it's one that's well suited to diaphragm pacing for two reasons. If we have the more severely affected child with CCHS, these are the children who don't breathe adequately awake or asleep. If we use diaphragm pacing on these children when they're awake, this is a small device that's battery operated that can be carried in a fanny pack or a backpack. So these children can actually go to school, they can run around, they can participate in things, and they're not tied to ventilator tubing, but yet they are being ventilated when they're awake.
First child we saw with a pacer, and Jimmy, we were trying to make the decision. We said, well, where's the young lady? And they said, oh, she's out in the backyard playing on the swing set, which is like, yeah, I think this is something we need to investigate, because Jimmy would be in his room, and we always had our family events in his room because he was on his ventilator, or we could roll it in the wagon down the hall. We weren't out in the backyard playing on the swing set.
The second group, the milder group of CCHS children, usually require ventilators only during sleep. And this is a group that we have found we can use diaphragm pacers on during sleep and often get rid of the tracheostomy. That is, it's a quote-unquote non-invasive form of ventilatory support.
Diaphragm pacing has proven to be a safe method of mechanical ventilation, allowing mobility and greater freedom in daily activities. And the general philosophy at Children's Hospital Los Angeles about ventilator care applies to pacer patients too.
To me, the program has to be safe, it has to be easy, and it has to be manageable. Unlike in an ICU setting, you have only very limited resources, so it has to be safe. It has to be able to carry out outside the ICU setting, and you have only maybe parents and some helpers. So it's not like in a hospital you have 24-hour care. So it has to be easy and manageable. So those are the three buzzwords that I have.
In our next chapter, you'll meet Monique and hear her amazing story of her use of diaphragm pacing and that of her two children.